Now from Washington, D.C. by phone is Chicago area Congressman Mike Quigley, Democrat there, representing the 5th District, which covers Chicago and then suburbs spanning out towards the west. Congressman Quigley, obviously a good day for Democrats after the Democratic majority was able to push through health care reform a couple of years ago, and now it withstood a challenge all the way up to the U.S. Supreme Court. But still, you have a lot of people, and as Ms. Mace of NFIB just pointed out, that are still not happy with the law of the land as it stands, and with this being election year, Republicans are going to be, chomping at the bit to try to get a change.
Well, thanks for having me, and I would just say it's a good day, but not just for Democrats. It's a good day for seniors who are no longer going to have to choose between paying the rent or buying their prescription. And college students recently graduated, they're no longer going to lose their insurance on graduation day. It's
because they can stay under their parents' policy till age 26. Yeah, a lot of the points we've been making during our coverage during this past hour or so has been there are aspects of this law that a lot of people would applaud, I think, on both sides of the political aisle. And, as you point out, the young people that can stay under a parent's insurance policy until age 26, seniors getting those all-important discounts when you're in a fixed income for prescriptions, and also being able to get that preventive care in many cases. But moving forward, Republicans still have a gripe. One could argue it's election year kind of stuff. But at the same time, there seem to be some who really do believe that the costs are going to be too prohibitive and fall on the backs of taxpayers in a way that, is just not fair.
Well, the fact is that health insurance is rising dramatically. It has been rising for the last 20 years dramatically. We have to address that issue. But the Republicans have really shown...
When you say health insurance is rising, you mean the cost of?
Health insurance costs have been rising,
right,
for our lifetime very dramatically, and that's what we're still going to have to address. The Republicans have shown absolutely no willingness to find an alternative to do this. I mean, let's remember the number one cause of bankruptcy in the United States is catastrophic health incidents that take place to a family. There's no alternative. There's no sympathy toward that end. When I go through my district, 1 out of 10 people are unemployed. 2 out of 10 don't have health care. For many of those people, the lack of health care benefits is more important to them because of the fear they have. They have an asthmatic child. They have one of the providers is without health care benefits and is facing catastrophic illness. I mean, that is extraordinarily important. Just to say that, well, this faces an additional burden, the burden is there. We're just trying to meet this cost.
Well, what about making it affordable, though, as you point out? And we've been discussing that this hour as well with numerous people, that I guess the idea under health care reform is that costs will come down for insurance policies where people, find it impossible to buy an insurance policy if you're not under some kind of employer group coverage because it's so cost prohibitive, so expensive to get your own policy. Now, under this individual mandate, there are going to be these exchanges that will help you to purchase a policy, supposedly with a subsidy and whatnot, but is the thinking that simply it'll be supply and demand as more people are forced to now get insurance under the law? More of a demand will create more of a supply of insurance, and that will then somehow bring the cost down overall?
Well, it will help individual people who would otherwise have to fend for themselves and try to find a policy to cover them. So it will absolutely help them reduce their costs. There's still so much more that needs to be done in that vein. And we have to hold insurance companies accountable for these rate increases and ensure that their premiums are being spent on care and not the overhead costs.
So far you're saying the law doesn't really address that?
Well, no, because, first of all, it got us 90% of the way there. Everybody recognized that there was still more to be done. On an ongoing basis, the costs were rising, and the bill's intention was to try to address that through the procedure that you just talked about. But we still have to start paying providers for keeping people healthy rather than the number of tests they run. So much more that needs to be done. No one anticipated that the bill would be able to accomplish all those things at first.
Sure.
But it was. Let's try to remember that presidents have been trying to deal with the cost of health insurance and providing health care for all Americans since President Roosevelt, and that's Teddy Roosevelt. So The Republican answer to this has been to complain and criticize, but there is absolutely no viable alternative that they have presented. I hope that they present something that's productive about how to meet the requirements of the poorest Americans,
sure. Well,
as well as complaining about it.
Well, Congressman Quigley, and I want to point out that we are taking a live view right now of the